Hi guys, it's Danielle with Warrior Women Portraits. I just wanted to talk to you a little bit about my diagnosis and what I was specifically diagnosed with and how it's different from a lot of the other women that are diagnosed with breast cancer. About 80% of the women are hormone positive, and what that means is when they go in and they do a biopsy, they run tests to see what is feeding the cancer. So what they do is they add either estrogen, progesterone, or HER2 positive. They add those to the cancer and see if it grows. In my case, it did not grow anymore with adding those three hormones, which makes me triple negative. And what that means is they don't know what actually feeds my cancer or fed my cancer. It's a harder type of cancer to treat because they don't know, which is another reason why I went the most aggressive route with my treatment, because it is a type of cancer. Since it is unknown what is actually feeding it, it can actually come back in the other breast. If any breast tissue is left behind, it can come back in other areas of your body because, again, they don't know what's feeding the cancer. So if there's cancer cells in your body elsewhere, it's the most chance of reoccurrence of other types of cancers. It's another reason why, after I had surgery, even though the tumor hadn't gone into my lymph nodes, they wanted to put me on chemo to make sure that any of the cancer cells that might be roaming in my body would be killed. And it was really scary, and it still is. I went to a retreat, and someone asked the question for everybody in the room who was hormone positive in their treatment, or their tumor was hormone positive, to raise their hand. And I could not see any women that hadn't raised their hand besides myself. And it was a real kind of gut punch to visually see just how different my cancer was. Now, in the end, there was one other person in the group. Out of, I think, 27, 28 women, 2 of us were triple negative. And because of that, it can be really, really scary. Because you just have to throw the kitchen sink at it and hope it sticks and hope it doesn't return. So I encourage, let's just change it to that. I encourage any woman that is triple negative to definitely reach out if they're curious, if they're worried, if they need anybody to ask any questions about. I would be happy to help. I'm obviously not an expert, and I don't claim to be, but I do have a little more knowledge on being triple negative than the hormone positive women, and just use me as a tool. All right, guys? It was so lovely to chat with you guys, and I hope you're having a lovely day. Talk to you soon.